This is our project on the female reproductive system.
The labia majora is a pair of thick folds in the skin and adipose.
The clitoris is the primary center of sexual stimulation. The labia minora are the smaller inner folds of the vulva. Bartholin glands are
two pea-sized glands located slightly posterior and to the left and right of the opening of the vagina. They secrete mucus to lubricate the vagina. The vagina connects to the cervix of the uterus to the exterior of the body. It acts as the receptacle to the penis during sexual intercourse. It carries sperm to the uterus and the fallopian tubes.
The uterus connects to the fallopian tubes on its superior end and the vagina in its inferior end. It also surrounds the fetus during pregnancy.
Ovaries produce female sex hormones such as estrogen and progesterone, as well as ova, as in eggs.
Fallopian tubes are a pair of tubes extending from the left to the right superior corners of the uterus. The inside of the tube is covered with cilia that help move the ovum to the uterus.
The ovarian cycle consists of the follicular phase, ovulation, and luteal phase, whereas the uterine cycle is divided into menstruation, proliferative phase, and secretory phase.
Oogenesis is the production or development of an ovum.
Estrogen and progesterone stimulate the uterus and breasts and cause the lining of the uterus to thicken more to prepare for possible fertilization.
Pelvic inflammatory disease is an infection of a woman's reproductive organs. Untreated STDs can cause pelvic inflammatory disease.
Symptoms include pain in your lower abdomen, fever, and a burning sensation when you urinate. Treatment includes antibiotics and penicillin.
PID can lead to serious long-term problems such as infertility. PID can cause scarring of the fallopian tubes, which prevents the egg from being fertilized.
It's vocab time. Ovaries are the female reproductive organ in which ova or eggs are produced.
Eggs are a mature female reproductive cell.
An oviduct is the tube through which an ovum
or an egg passes from an ovary. The fimbriae are connected to the ovary. They pulsate inside the fallopian tubes to guide the ovum or egg from the ovary to the uterus.
A zygote is a diploid cell resulting from the fusion of two haploid gametes. It is a fertilized ovum.
An implantation is the attachment of a fertilized egg to the wall of the uterus at the start of pregnancy.
The uterus is the organ in the lower body of a woman or female mammal where offspring are conceived.
The cervix is the narrow neck-like passage forming the lower ends of the uterus.
The endometrium is the mucous membrane lining the uterus, which thickens during the menstrual cycle in preparation for possible implantation of an embryo.
The vagina is a muscular tube leading from the external genitals to the cervix of the uterus.
The vulva is the external opening of the vagina or reproductive tract.
Follicles are a small secretory cavity, sac, or gland.
Polar bodies are small cells that bud off from an oocyte at the two meiotic divisions and do not develop into ova.
Ovulation is a discharge of ova or ovules from the ovary.
The corpus luteum develops in an ovary after an ovum has been discharged, but degenerates after a few days unless pregnancy has begun.
The term menopause describes the changes a woman goes through either just before or after she stops menstruating, marking the end of her reproductive period.
Estrogen is the primary female sex hormone and is responsible for development and regulation of the female reproductive system.
Progesterone is the hormone that can prevent changes in the uterus in women taking estrogen after menopause.
Menstruation is a woman's monthly shedding of the lining of the uterus.
Placenta is a flattened circular organ in the uterus of pregnant mammals, nourishing the fetus through the umbilical cord.
Human chorionic gonadotropin is a hormone produced by the embryo after implantation.
Thanks for watching.